we're gonna show you the contouring of the face. We're gonna do what we call the liquid facelift, which is we're gonna put fillers in different locations to give a nice lift of the face without giving too much volume. We're gonna start by drawing our points to see where we're gonna put the fillers. We're gonna work on the temples to give a nice backward lift to the eye on both sides. We're gonna do cheeks, but we're gonna use a lifting product. In this case, I'm using Restylane Lift. But whenever you put fillers in the cheeks, in some patients, you create a divot just under the cheek, and this gonna give age to the patient, so the patients will look a bit older. So to be able to give a nicer lift, we're also gonna put some fillers in this area, and then we're gonna define the jawline to give a nice lift. When it comes to the chin, women are supposed to have a chin that's not square. It has to be more pointy. So we're also gonna work on this. So to make the nose look smaller and for the lips to look better. And definitely it's gonna help with the neck, because it's gonna, when you project the chin, automatically the neck is gonna, you bring it forward. So it's gonna give her a tighter neck. So for the cheeks, I'm using Restylane Lift. I love this product because it's gonna give a very nice lift without giving too much volume. All right, the procedure is not like really painful. Just feel like a small prick. So based on the face, you decide how much you're gonna put in each point. I choose the point that's gonna give the maximum lifting capacity, because the point is to give her a lifting, not to give her volume. So in this case, I'm doing 3, 0.2, 0.2. So as you can see, the face is starting to lift up. And the nice thing about this procedure is to give character to the face, and it gives a nice defined cheek, and at the same time you give a nice volume without too much filling the cheek. So now we're gonna project the chin. Now you're gonna feel a bit of heaviness. You're gonna feel it's a bit heavy, but look how nice when the chin is nicely projected. And we have to respect the symmetry. So the lower face has to be equal to the middle face and the upper face, to keep the symmetry of the face, to have a nice symmetry. Otherwise, now we're gonna do temples, and then we're gonna do the lower cheeks, and then the jawline. So if you look, when you put fillers in the cheek, automatically this becomes deeper. And this is not something we like, because this is gonna give age, and that's what I was saying before. So it's very important to put some fillers in this area just to make the face more in harmony, all right? So you're gonna see, look, when we do fillers, you do like a fanning technique. So understanding the face is very important. You never do the same thing on every single patient, because every face is different, and this is very important, guys. It's very important. You have to understand the dynamics of the face. If you understand the dynamics of the face, this is when you get a nice result. So now we're gonna work on the jawline. ما بدنا نعرضها، بدنا بس we just need to give a definition. So I choose my points carefully, and we give her a nice definition. Always after doing the fillers, you have to advise the patient to drink a lot of water, and the filler, you see around 60–70% of the result on the spot, and the left you see it within 6 weeks. We're gonna do the temples, and we're gonna be done with this side. مش معقول حقيقتي، شوف قد ايه. You're gonna love the result. شكة صغيرة. So the temples, they lift the eye backwards, and by lifting the eye backwards, it gives you a very nice and a very fresh look. So now we're doing the other side. So we always put the same quantity right and left, unless we have a very obvious symmetry. Dayman, there is always 5–10% difference between the right and the left face, so it's totally normal because it depends on the patient. If you sleep more on the right side, or that's why it's best to see the patient after a couple of weeks when all the filler is settling down, and this is when you reassess, you do your final touches. Amount, today we're using 5 syringes, next time we'll use 1, all right, just to maintain the face. The most important thing in this patient, we have to make sure her skin is perfect. If you have a perfect face shape, but your skin is not perfect, it's not gonna look nice. So at the end, we put the collagen mask.